So old ideas and their legacies in action and policies, some recent examples. Thank you. I've used these for, and I suppose I'm aware that sometimes these people that I'm quoting here have done some good things. I'm not going to... It's easy to actually condemn someone when they're not there to actually argue to you or to... So it's very easy to put up the straw man, as my late husband used to say, you know. So, but I just want to give... These are written quotes, and I just want to say in relation to how they silence us when people come out and say things like this. So the first one is Professor of Anthropology he's an emeritus Professor of Anthropology at the University of Adelaide, Professor Peter Sutton. The second quote is from a former Queen's Counsel involved in the Royal Commission into Aboriginal Deaths in Custody, Hal Wooten, and a prominent psychiatrist working in Aboriginal health, Dr. Ernest Hunter, and a professor of economics in the Howard government think tank from the Centre for Independent Studies, Professor Helen Hughes. Thank you. So in terms of just some of these ideas, so these are the ideas that inform policy in our country. And over the last 11 years, we've had major assaults on... So we've had the history wars, some of you may have heard of that, where those historians, those non-Indigenous historians, are actually documenting the massacres were being opposed by people that... and those people who opposed their figures who had not done similar research, so but who were given prominence in relation to the Howard government's view on history. But in this case, Peter Sutton, he says that family, and these are the points that have been summarised by the late Professor Maddox, also from the University of Adelaide, who I don't know if he's a friend, but anyway, he documented these, and it was just an easy way for me to put these up just quickly. That family and community violence are deeply rooted in pre-contact tradition. The infants are stimulated to react angrily and aggressively by being cruelled, as Sutton calls it. That men's violent and demanding behaviour to women has its foundations in the way boys are brought up. That traditional beliefs and practices impede better health, and that family loyalties override regard for the interests of others. So this is a totally damning description of us. You know, to find a way out of that, to actually, you know, so I like to put these things out so that we can wham them, so we can actually talk about them and know what we're facing. Next one, please. Hal Wooten. Now this quote, Aborigines have to do it themselves day by day, shame the drunks and abusers of women and children, reject the rorts, get kids to attend school, eat better food, take more exercise and aspire to a future beyond grog, prison and early death. They must bear legacies of racism, historical injustice and broken families as burdens, not as excuses or disabilities that empower. That might be fine if that was being said by an Indigenous person, but it isn't fine when it's actually spoken out there and presented to the wider public, the Australian public, about us. Again, these are examples of our struggle to be treated as subjects, not objects. Next. And this is from Ernest Hunter, who thinks Peter Sutton is correct when he suggests that everything, including the question of perpetuating outback ghettos or other similar bureaucratically maintained institutions, the encouragement of corporatism as against the pursuit of individual needs and aspirations, de facto laissez-faire policing policies with regard to Indigenous community problems of violence, petrol sniffing and drug abuse, even separate Indigenous service delivery should all be on the table. Again, these are discussions that we have as community. They are not discussions that we expect to be carried on without our presence and as advice to government. The next one, please. So these are ideas that then have, in the recently, you may not have heard of it, there was an intervention in the Northern Territory on the announced on the 20th of September, supposedly based on a report called Our Little Children Are Sacred, concerning child sexual abuse. I don't think the Prime Minister has ever read the report, and certainly what ensued was basically the recommendations here put forward by Professor Helen Hughes, an economist who's served in senior management at the World Bank. And she in her book Land of Shame, she concluded that small Indigenous communities in the Northern Territory should be closed, that administrators should be appointed to Indigenous communities, and you read that's non-Indigenous administrators, that the permit system should be abolished, that the Community Development Employment Program, which actually is working for the dole, should be abolished, and that communal title should be replaced with private home ownership. Next one, please. And these are some of the statements that she's stated, that their health and housing are so abysmal that their life expectation is 20 years shorter than that of other Australians. Deprived of education, so you'd actually connect that to the top, that's the reason their housing and health are abysmal. Deprived of education, they cannot access jobs even in settlements near mines and tourist resorts. Remember, going back to Roger Solomon, leading to welfare dependency and consequently family and social dysfunction. Next one, please. The homelands were created with the best of intentions, as if people had not asked for their land and to be on their land. However, they not only have failed to provide a living for Aborigines and Torres Strait Islanders, but they have stultified the development of traditional culture so that alcoholism and violence demean and destroy many lives. Thank you. So these are examples of what I mean by the struggle, the ongoing struggle to be treated as subjects, not objects. It's an immense topic, and I suppose an immense struggle. And in terms of my work in the School of Nursing, we're still in major sort of... our Dean has had some really awful discussions with the head of the health science faculty. And so I'm just saying that I wish I could talk to you about all the implementation of cultural safety in Australia, but I can't. It's an ongoing struggle. Thank you. So the funding levels and conditions under the Howard government meant infrastructure and service delivery standards for Aboriginal people fell into decline, and Mr Rudd will need to increase health, housing and infrastructure funding to close the gap. This was signed by some of our Indigenous leaders just recently, a couple of weeks ago. Thank you. How do cultural safety approaches address these issues? Indigenous workers need Indigenous government workers, for example, who actually have had to implement these policies, often need to justify their rationale for money spent on prevention projects in the context of a crisis in some communities. And the arguments about what should be happening often hinge on evidence that is difficult to obtain. Excuse me. And further barriers to achieving that. Again, I think I've outlined that in relation to economic rationalism and institutional racism, and it connects with individual pathologising of problems rather than community development principles. Thank you. So, in terms of actually what do you evaluate when you're looking at things that that a project that would be addressing cultural safety would look at? So this is from David Legg at the University of La Trobe in Melbourne. He says you can have outcomes for today, measurable health gains, outcomes for tomorrow, improved health care or health promotion delivery, but it's the outcomes for the day after tomorrow and the day after tomorrow, etc., the enhanced institutional, professional and community capacity that is really important. So that's, I guess, the long-term aim, having some principles that guide your work. Thank you. So how is it done and for whom? Is the individual the focus or the position of the community as a whole? How is the community defined and by whom? Who determines what outcomes to aim for? Next one. Just some researchers in Western Australia say that it's very difficult that government funds programs that allow time to build culturally safe places where people can be offered healthcare choices, for example. Next. Places where people can meet and develop community networks. And if we look around in every city, the community facilities that are there for non-Indigenous people, you know, the bowling clubs, the choirs, it's just, those sorts of things that that enable things to happen. Next one, please. So in terms of the distancing, in the health professions, that you're required in the Western health tradition to actually have some distance from the person that you're seeing, keeping a professional distance. And in terms of how Aboriginal people see that, certainly working in the Aboriginal Medical Service, that, they are so pleased when people come to work in their service, and when and particularly pleased when those people that work there, the health professionals, are Indigenous people. You become this bridge to enable people to get care. And obviously, there's obviously lots of good things about Western healthcare, but just having our people there to create those bridges. Next one, please. So ways that distancing, it relates to what Diane spoke about in relation to siloing, the compartmentalising of health, and it's a denial of the relationship between land and life, and the failure to acknowledge one's positioning in a global context. In short, it's an institutional view that has given rise to particular outcomes, many of which are very beneficial to outcomes in the Western health system. Thanks. I use this diagram with students to basically say that if you take out race and racism in here, and just imagine that whole thing. So for us, before 1788, which is when Europeans came to Australia, that we actually had a system, a framework that enabled our health, and everything was tied in. So a system. So this is basically when you've got a dominant culture and a dominant system that you are having to deal with. And like I said, what are the places for health and well-being that are spread out through the country? And one time that would have been the case before people became a minority. But all of these things, what Williams is saying, and it's picked up by Professor Ian Anderson, the Indigenous Professor of Health at the University of Melbourne, is that unless these basic causes change, then there'll be very little change in the health status at the end here. That all of these things are structured together. And as we know, if people are unemployed, if people are without housing, if the legal structures don't address their needs, etc., then even though we have a health system that might focus on health practices or stress or psychosocial, or and we're looking at different areas of medicine, etc., our health status won't change unless these things here change. And people going to work or either work in there or to actually to have to deal with those structures encounter institutional racism or overt racism. So it's just really I guess in terms of what that means in relation to generic health education, it's to me it's very straightforward that that has to be taken into account. We're part of a world. We often overlooked in terms of our view of the global situation because we are not. Many of us are not. Don't agree with the economic development that's going on, and certainly the contribution of that to climate change. And I'm just saying that the world is eating more than it produces and food prices may climb for years because of the expansion of farming for fuel and climate change, new report says. Thanks. So the world, and I use this word from an Indian writer, Gayatri Chakravorty Spivak, who talks about the worlding of the world. And it really relates to, I guess, to colonialism and imperialism. The world, with, you know, the mighty impetus of those global movements on peoples, on our life. So how the world is worlded. And, you know, our relationship to land. So just to summarise there, that values underpin what we perceive and believe and value and do. And I certainly will continue to unpack this for students and in relation to ongoing work that we do. When making judgments about Aboriginal and Torres Strait Islander peoples, Australia and its public institutions must acknowledge the history and bridge the difference in cultural outlooks to find a fair, respectful and ethical way forward. And this is my friend, Dr. Irene Watson, who's now joining our faculty. She actually was invited, I think it was in 1993, to be part of one of the jurors on the case brought by the Council of Native American Chiefs against the Government of Canada. She was one of the people that came to serve on that. But and she lives in Adelaide, and she, as I say, she's coming to work in our college. But she said, when you have looked down the barrel of genocide, you see the world in a different way. So for the next one. And I just go back to Edward Said. Knowledge is most like itself when it undertakes to counter and oppose unequal distribution of power in the world. Likewise, knowledge is least like itself when it becomes institutionalised and starts to collaborate with the interests of a dominant or ruling elite. Thank you very much.